on YouTube, and this is actually Amazing Plants Formations too. We got two shows in one. I love it. Because you are going to transform plants form our, health. And so mine still says waiting for vegan knowledge. Do you see that we're live?
I saw that you're live. Yeah, I
Oh,
definitely
it
see
just
you're
popped
live.
up. Okay, I didn't want to
Okay,
go through the whole show and all this beautiful knowledge you're going to bring us, and it's not even going. I'm like, there must have been a delay. So, welcome, welcome, everyone. If you're here in the chat or if you're not yet here, I think my phone is up now, so I'm hearing my own self talking. I'm going to check the chat real quick to see if anyone's here. Oh, look, it's Angela. Oh, thank you for commenting. And Vegan Knowledge JJ. Um,
yeah.
I am so happy that you have returned. We had Angela on and she helped us with a guided workout before. And that's the first guest I've ever had. And I think anybody has. I love the way she does her format. Not only does she share her knowledge with us, but she also puts it in action and shows us a workout. Um, so, Angela, if you don't know who she is, I'm sure everybody does if you're on my channel, because I'm always talking about her on the Vegan Knowledge group. First of all, she's one of the kindest people, the most supportive friends that we have. She's always promoting everyone, and I'm really thankful for that. She is with Boomer and Beyond Wellness, which is like, I mean, you can reach out to her and check out her website. I'm going to have all the links in there. She helps. And what is the age range you would say? I know you help everyone, but would you say Boomer is
Well,
boomers?
it's a little bit slightly younger than Boomer because my work is so much involved with people who are dealing with chronic conditions or maybe post chronic conditions and surgeries, etc. So I'm putting it at 50 and way beyond. Okay, like really way beyond, right? Because I
Okay.
work with people in their 90s, even
Wow.
in their hundreds. So it's that kind of. But the thing to understand is that's a lot of different decades, right?
Hmm.
And some people who are 50 may very much kind of relate to the issues of an 80-year-old, and
Right.
and there will be 80-year-olds who can do what a 50-year-old can do.
That
So
is
it's
true.
really, yeah, so it's really depending upon what's going on with somebody. And so basically, what I do is I kind of observe and then get information from their medical healthcare practitioners as to what's contraindicated, what's not contraindicated, what do you suggest, is contraindications with the medications, etc. Because my whole thing is that we have to figure out a way to make exercise work for each individual.
Hmm.
So that's really what that station is all about with my YouTube channel. So what we're doing there is we're presenting work really from three different angles. One angle is demonstrating the strength training work without any resistance. So that's going to be for brand new people to exercise, people really dealing with these different chronic conditions, right?
Hmm.
And then, or brand new, maybe just strength training. And then we take it where we'll add in lighter weights or tubes and bands, and then full out with the weightlifting, right? And so it depends. But one of my classes can be broken down in all three ways: beginners, intermediate, advanced.
Oh,
And
that's neat.
yeah, and the age group is still the same because we can't just sum everybody up in a clump and say, oh, you all have chronic conditions. Well, not really. What if you have one, or maybe you're on one medication? So then you need to understand how to strength train with that medication
Hmm.
instead of, well, doing something that could be contraindicated, right? And then
Right.
you hurt yourself from the medication and the exercise, and that's just no good. So that's what my channel is all about. It's a little bit different than like people coming there for HIT and that kind of stuff, for Tabata and all that. It's really more about working with the chronic issues, how to design with that in mind for the individual. Got to
Mhm.
know about the individual because one person might have osteoporosis and their symptoms are a bit different than another person, right? So you
Mhm.
have to know how to work with those differences, and that's what I do.
That is really interesting. I know for me, I love your channel because I can find workouts that, like, I love one thing you said. It was like, don't think about what you can't do, figure out what you can do. I've heard you say that on a lot of your
I say
videos,
it
and I
every
love it.
Thank you
Yeah,
for that. I say it every
it's
time,
so
and I'll say it
true,
today.
because
Yeah,
I used to say, well, I had, I used to have chronic back pain. So when I went whole food plant based, and I used to work out, and it would actually feel better when I would work out because it would stretch the muscles. And I would work out on an exercise bike, and I, never knew if I maybe lifted too much. So I was like, afraid, like when I see some channels they're lifting these weights, or I hear people talk, and you realize you don't have to get from here to there. What you teach us is how you can increase it slowly, which I love, and we'll probably do something like that at some point. I know you have a couple of ideas for us. And then I know we were talking with you about Dawn and her issues with, her hip before, and like you've just been a really wealth of knowledge. So I would just say, anybody who's watching, if you're dealing with anything, if you're even immobile, if you think that you can't work out, Angela's a great resource, to reach out to, because she has all that knowledge. You're not coming to someone who's going to push you to somewhere that you don't need to be, but will get done
yeah.
what you need to get done. How did you get all this knowledge? Like, what made you get into this, like helping
Well, this is
people work
I
out?
got isn't this interesting question? I got put into it. This is what's interesting. Because okay, I'm 65. I began personal training at 30. Okay, and but I was training years before that with on myself, right? However, when I got certified, I was hired by the gym that I was actually a member of. I love that gym. And do you mind if I say the name of it because
I don't mind.
they're still in
I love
existence?
helping
Oh
businesses. You
my
know
goodness,
that.
it's a mom and pop place, but it's phenomenal. It's called Eastern Athletic Clubs, and they're in the branch that I used to work in a lot was in Brooklyn Heights, but I also worked at the Park Slope in Brooklyn, and so they hired me, and I wa I it was so fast, JJ, after getting hired there that the fitness director and his wife approached me and said they were going to be leaving the gym, and they were kind of like spearheading programs for seniors and
Wow.
at the gym. And then, but I don't remember the because it's 35 years ago. But there was the manager of the gym was a woman who at the time I'm going to put at about 65, right? But
Okay.
I was, I was 30. And so she approached me shortly after that and said, "We want you to run a senior sport program here because we think you'd be great with seniors." And I said, "You're right." Because JJ, it was all about my relationship with my mother's parents. I
Wow.
was so close to them, and particularly my grandmother's siblings, because she had a lot of brothers and sisters. They were all from Italy, and whenever we got together family functions, I loved my cousins, but I always was looking at the table with the elders who were laughing away at life and having so much fun and just is speaking Italian, just this gorgeous language. And I was like, yeah, I love my cousins, but I'm hanging out with
This
them.
is where, and that's weird. We have that in common. I've always hung out with people like that, like even at family things. I was never at the kids' table. I was
Yeah, yeah.
always over with
I was
the
like,
adults.
I'm there, And so, my grandparents passed. I think I was 18 when my grandmother
Oh, I'm
passed,
sorry.
and 19 when my grandfather passed. Right. And thank you. I appreciate that. But So when they approached me about the seniors, I was just like, yeah, this is a fit.
It
So
chose you.
well, they just went, and what they did is they paid to put me through a program that was sponsored by it was run by, I should say, the certification was with the American Senior Fitness Association. And at the time, it was a year-long program. It wasn't one of these weekend things. It
Mhm.
was a full year, lots of testing, you had to go on site testing and, of course, do the work on your own. And it was a wonderful opportunity for me to apply everything right there at the gym.
Mhm.
And then we created a lot of momentum within Brooklyn Heights because we used to do stuff like, there's certain like senior days, right? Well, I would take them and we would do walks across the Brooklyn Bridge and back. And I'm talking with 80, 85-year olds doing this walk. And I would take food. We all brought food.
That's
And
neat.
oh my goodness. And I would be really like, some of them would be just hoofing it across the bridge. So I'd have to run to catch up with some of them because at intervals, we would walk in place and I would check their heart rate and just make sure that they were okay with how they were feeling. And if anybody needed to stop, every time we did this, everybody completed the journey
Wow.
back and forth. So into downtown Manhattan and back they went with me. And it was incredible. And we did other things like I took them into the local supermarkets. I think one was called D'Agostino's at the time. And we would do like we would look at stuff that they like to buy, groceries, and we would read the labels. And I would show them back then, this is what you look for. Forget about the words on the package. Read the ingredients.
Right.
Right. And read the ingredients. I don't give a crap about the nutritional stuff other than look for the fat and look for the sodium, right? And because they began to understand that when they're reading the label, it was like, well, wait a minute, half these words, more than half, I can't even pronounce. And I'm just like, yeah, it's not real food. It's just not real food, you know.
Exactly.
So this is the kind of stuff that we did. They
That's
used to
great.
I used to do presentations in Alphabet City in Greenwich Village at a restaurant. They're still in existence. Vegan, folks, vegan, phenomenal, kosher. Is called Caravan of Dreams in New York City. And I used
Nice.
to do, he used to, Angel, and he's still the owner, used to bring me in, and I would, with bands and tubing and stuff, I would teach exercises in his back room, do a presentation on how to use all of this to help with osteoporosis. And these women would walk over the bridge and go there to the restaurant to join with me in the workshop to then stay and eat vegan food. And it was really novel for them, but they were so into it. And they got to the point where they would meet each other at the gym and work out. I taught them how to spot each other, it's called, to help each other
Yeah.
with equipment. They learned it all. And then I would get phone calls from them, sometimes on a Saturday or Sunday. Hey, we're having a party over at Marion's. Come on over. So that's how it all began, is just because the managers said, this would be a fit. And it really was. And for the next 11, 12 years, I worked with them. And we had the local television stations used to come in and film us to
Wow.
promote the program, to promote the senior program there. It was really a vibrant, incredible experience.
It sounds like it. That is so, like, rewarding, it sounds like what you were doing too, especially with your love for elderly,
Oh,
or older people than yourself and wanting to help people because you can tell, like, when you meet someone who truly cares, like, you don't go
yeah.
in and do things for, like, "Oh, this is my job." You got into it and really, like, are concerned about each individual person and you don't try to blanket everybody in one category, which is really cool. And you mentioned osteoporosis, and I know that you have so much knowledge. I know, like, how long do we have to talk? Because I know you want to get your workout
Oh,
thing in.
probably,
Am I okay for a few more?
yeah, but let's take it like for another 5. Is that okay
That
with
sounds
you?
good. Yeah, I didn't.
Great.
I mean, because I love, like, picking your brain of knowledge, so
Oh,
I'm
it's
like,
okay
there's
by
a
me. I love
thousand
being
things
here.
we could talk about. We could do a whole show where we're just even talking, right, and
Yeah,
never get to the
sure,
workout, but we don't wanna
sure.
do that because everybody's looking forward to it. Okay, so, you actually, and I don't wanna use the word, I don't know exactly how to say it, but would I be able to say eliminated symptoms of your osteoporosis?
Well, how I put it is that I downgraded it. So it
Okay.
was officially a diagnosis of osteoporosis, which is a pathology. Okay. And so when you read it in literature, it is spelt with an uppercase O. Osteopenia is not. It's not a pathology. It's just an indication of bone loss. Now, this said, for bone loss, I'm always going to recommend that people strength train. Okay. And I have to strength train for the rest of my life because osteoporosis can come back. Right.
Mhm.
So, but osteopenia, the thing is that right now it seems to be pretty popular to a bit dramatize the diagnosis. I was very happy to be downgraded to what I call age appropriate osteopenia because we're supposed to lose estrogen as we age. This is not an illness. This is not an illness. And
Okay.
on many levels today, it's being treated as an illness and trying to encourage women in particular with osteopenia to start taking certain drugs and medications. Now, I'm never going to tell anybody not to do that stuff. Not my place to do that. But what I am going to tell you is you need to look at other options as well. And should you decide to take those medications, these other options can further benefit you. If you decide not to take the medications and you're okay with the reality of losing estrogen and that perhaps Mother Nature had something bigger in store for us as aging women, not 100% of the time, but quite often, the loss of estrogen helps prevent certain cancers later in life.
Wow,
So,
okay.
right. So I never undermined Mother Nature. And
That's reminds me of tonsils. Everybody was getting their tonsils, 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 and then, I never got mine out, and I was so
I did.
glad, that I didn't, because then I heard later on, but so many of us did, and I was probably this close. I don't even know why it never happened, because I'm sure I probably would have, because if they had told her, get them out, she wanted our parents wanted what was best for us, in most cases. So they were trying to do everything that they're being told, which is why I'm like you. I am so glad that I started doing my own research, and that we don't need milk for strong bones, and we don't need meat for protein, and it's in fact causing a lot of the inflammation and issues, the things there. So just do your own research and listen to Angela. She knows what she's talking about here.
Well, I am a huge self advocate for health, huge. And so when I got presented with various practitioners wanting me to chop out parts of my body, I was like, no. I
Not
know
gonna
there,
happen.
I know there are other ways, and you're not going to tell me that my ovaries, well, you don't need them later in life. You come talk to me and tell me when you're told that about your testicles.
Mhm.
It's just the bottom line. So it's just a matter of, but for somebody else, they might say, take them out. I feel a lot more comfortable without them in there. Okay, that's your decision. Got to leave these choices open for everybody. That's all. That's what I'm saying.
With the right information, though, I think a
Yeah.
lot of times people are only given one side of the
Yeah.
information. That's what I love about this channel, and it's about empowering people to make their own decisions. Everybody is an adult, especially that's here on YouTube, and you can make your own choices. I think my biggest problem is that everything is so one-sided, in the media and what we've been told, that I think I'm really happy for people like you who show people they have another way to do things. There's not just one, you don't have to
Right.
have it, maybe it comes to that, that this is really what's best for you, but at least look into it, the holistic healing, because it's so powerful not to get in that system, I think, in a lot of cases, because it
Right. I
leads you.
mean, I'm sorry, go ahead.
Oh, I was just going to say sometimes one thing can lead to other problems, than that you didn't need when you just start, you know.
Happened to me. Happened to me. I was put on certain medications. Uh, They'll be very forthcoming, psychotropic medications. And back when I was about 32, maybe, I think it was 32. And well, we now know that lithium, a medication I was on for 2 years, from 32 to 34. I'm 65. Okay. At 60, I got diagnosed with a couple of thyroid nodules. My endocrinologist, a specialist who specializes in hormones, your glandular systems, all of that. Okay. She said to me, well, we now know that lithium causes thyroid nodules.
Oh
Mm.
man.
And it's still on the market.
Well, have you ever heard the end of a commercial? Like, I can't believe they've got the people dancing around how happy they are, and it's like, may call, it's going to fix your acid reflux, but may cause death and,
Right.
constipation and other cancers. Like, okay, if I'm going to take a medication that's going to cause another type of, diabetes or,
Right,
anything,
right.
why would I take that for one thing? And if you know those risks, but I think because people feel up, cornered, they don't have another way, or they don't
Yeah,
know, like
yeah.
we've been able and blessed to find something on, I don't know how you started your vegan journey, but mine, I saw a YouTube video of people healing things from a raw vegan diet, and it just turned my life around. So thank you for presenting your channel and getting out there and getting into the uncomfortable zone of doing this, as a passion for your living.
Well, thank you. I really, really appreciate that. I do want to say that not all medical doctors have
Mm-mm.
are single have a single view about this.
That's
Not
true.
all of
Yeah.
them, okay?
There's
Because
lots
there
of great ones.
yeah, there are. And even, even not within our plant-based community, because I'm always going to tell people you need to get a plant-based doctor because they have a better understanding of exercise, of nutrition as it pertains to how we eat, right?
Hmm.
And certainly you want to be able to work with somebody who, if it's a medical doctor, you want to look for somebody who's board certified with the American College of Lifestyle Medicine, ACLM.
Hmm.
And these are the guys and gals who are up on the nutrition, who are up on exercise, who are up on wellness and all these different approaches to self-care.
Hmm.
So they're out there. So I'm not saying everybody's one way and short-sighted and narrow
Yeah,
vision.
I
I'm not,
think
honestly, I'm not.
that's so true, because there are many, especially like, well, thank God our medical community is out there, I mean,
Yeah,
they are so important to us in so many ways, and it's great to have them there, because when you need that, you want someone there who's qualified and who they have a lot of care and compassion to help people. I just think in the way that we were all taught, in other words, and even the medical community, I know, Dr. Clapper's doing a lot of work to go in and educate medical students on nutrition and how important it is. I just think it may not be as widely, like you said, accepted if it's not in the plant-based world to discuss nutrition, but many of them
right.
do. I do find that happening more and more, especially in this day and age where things are starting to come out a little more about how nutrition can play a part, and in your world, exercising, and it definitely doesn't need to be the final thing people are discussed after. I think it needs to go right hand in hand, like you said, with people to help them make those decisions. And
Right.
I know we could go on and on about this, so thank you for
May I just say
explaining it.
one other thing
Oh yeah, I'm good.
About Dr. Michael Clapper. So the name of that organization that he does this for, okay, and he created the organization, I do believe, is called Moving Medicine Forward, and it's a
Okay.
nonprofit organization. So if you have other plant-based people who are interested, you really want to check that out. And therefore, on that website, you're going to find a whole lot of videos of Dr. Michael Clapper talking about certain subjects, etc. And he has a very, very powerful video on out there about osteoporosis, and it's preventing and reversing osteoporosis. It's what it's called. And so you want to look for that if you have osteoporosis, because you're getting another perspective on the medications, the classifications of medications, and what the options are. And that's what you want. You want to have options.
Yes, and we want to be like you, who didn't need the medications, right? And did exactly
Well, I mean, I took the medications and wound up with thyroid nodules,
right.
So that's why, it's like, I'm sorry, I'm just not the first person to leap toward drugs
Hmm.
anymore. I'm just not, but I understand they're there. And certainly if I had an infection, which I had like I forgot how you pronounce it, but it's a form of cellulitis in my fingers. And because I got it from massaging a client and I wasn't wearing gloves. I wear gloves now, and I had this terrible, terrible
Oh,
infection. And let me tell you something, my fingers were turning black. Okay, that's necrosis, that's death of the tissue. And so I was like, I went to the emergency room and I'm like, give me the antibiotics, give me the
yeah.
antibiotics,
I don't care what's going on now.
give
This
me the
this needs to.
antibiotics, and
Yes,
you
they've saved
have
my
to,
family's life, both my mother for an infection and my little sister for her seizures. Like there's a need when it comes to
right.
medicine. That's, and I'm glad you're okay. That sounds terrible. Like,
It happened really shortly after I got my license too as a massage therapist. And I'm like,
oh no, so you were learning like, okay, what is going on? Never took those
whoa.
gloves off again, did you?
I said for me,
Well, a couple years ago, we were all wearing gloves just to go in the Walmart, right? So,
right. And for me, I was like, well, it's just natural for my work,
right,
So
there you go.
yeah, you know,
You already
um,
had the box of gloves, right? Um,
exactly, exactly.
I did
Um,
have, well, we'll save that for next time, or I'll ask you offline. I had one question I wanted to ask you about a
Go
word
ahead.
that's been in the
Ha-
media a
hang
lot.
it.
Oxalate, oxalate. Do you have any thoughts on that? Like, do they build up and cause joint pain if you eat too many, like too much spinach and stuff?
Okay. I don't elaborate too much on nutrition because I
Okay.
consider that there are a lot of trainers out there doing a lot of blah blah about nutrition and don't have anything other than some short course they took or whatever. That's outside of my scope of practice. This is
Okay.
what I've heard. I have heard it's a lot less offensive than what it's being made out to be, because apparently, not sure, you got to double check. You have to have really a lot of oxalates, so like spinach, and other foods that have high oxalate count, a lot of oxalates in them. Okay, I'm like, how do I say this?
I
And
don't know how to say it
so
either.
I'm like, oh, duh. So I believe, if I recall correctly, that I've heard from Dr. Joel Furman that when you cook the food too, you cook out some of those oxalates.
Okay.
So I can't advise anybody on that because I'm not sure. But
That
what I
makes sense. I was
but
just thinking, with it when it comes to training, I wonder if that had, any, if you had heard of that or had any, and I know
oh
you
yeah,
you studied up on it. I can tell.
I have heard a lot of people have, a lot of people are discussing this, but I think it's gotten out of hand, and I think it's a lot of hype. I'm
Mhm.
not saying that's not true. And certainly for, let's say, if somebody is on blood thinners,
Mhm.
okay, they have to chat with their doctors about how much green they can have
Got it.
and
Okay.
dark green leaves. Okay. So because it can really interfere with the blood thinners. So I'm not saying that they should never have those dark greens, but if you are on blood thinners, you need to talk to a doctor who understands nutrition. Your regular doctor is going to tell you, you got to stop the dark greens. But a plant based doctor is going to say, we negotiate your
Intake.
dosage of the medication so that you can have the dark greens, but you just don't start that by yourself. You just don't start eating all the dark greens and you're taking blood thinners. That is not advised.
Good to know.
Yeah, it's
And
just a little tip.
what do you have planned for us this evening? What is our
Well,
workout gonna be? What is
it's not.
on the agenda here
It's
on
not really.
Angela's
It's not
list?
really a workout, right?
Okay.
Not really as such a workout, because that's going to imply a lot of efforting and stuff. What we're doing here today, it's called hip mobility, and we're doing it in a chair. And the reason why I wanted to do it in a chair is because I'm finding that in today's day and age, I understand the intent behind the expression of sitting is the new smoking. However, it's really used to me in a little bit of a judgmental way, and it's a little elitist.
Mhm.
And I look at this and go, okay, we have people because of health and because of work, long hours, right? Are sitting in a chair and simply they can't help it. So, why don't we change our perspective, look at a chair and go, how do I make it work for me? What can I do in that chair that will be some kind of exercise, stretching, mobility? So I've done strength training in a chair and I'll continue to do that stuff for sure. But I want to show about hip mobility, and because it's so associated with back issues, gluteal issues, hamstring issues, and
Hmm.
how can you use the chair? Now, for the audience, I want to say that I found a wonderful article online with Healthline from Healthline, and it's titled, check this out, Why You Don't Need to Be Gumby. So it's mobility versus flexibility. And it's by Meg Walters, and it was published, let me double check the date, July 9th, 2020. So you can research this for yourselves and look at the article. And this is what she talks about, because what she's doing is clarifying the difference between flexibility and mobility. Because I'm going to bet that many people in the audience use these words and interchange them. And before
Okay.
I understood what their real definitions were, I kind of did that too. All right. So I'm going to read off to you word for word because I like to be accurate with somebody else's work. So this is what she said. She said, flexibility is a muscle's ability to lengthen passively or without engagement. When you perform static, and I put in parentheses, kind of like holding still
Hmm.
stretches using body weight, limb support, or props, and we're going to be using props today, you're
Nice.
working on muscular flexibility. Then she says mobility is related to joints and their ability to move actively through their full range of motion. So I'm going to step back for a second and I'm going to show you that I'm going to do a big high kick. That's an active mobility. I'm putting my hip into hip flexion. So the hip joint does a number of movements. And what we're going to do is show how you can sit in a chair and say, hey, I'm going to make peace with my chair. And you're going to do a bunch of movements. Yes, you're going to do stretches. You're going to, of course, affect other joints, because it's always important to remember that movement, exercise, whatever you want to call it, is never reductionist. It's never about, well, we're doing hip mobility and therefore nothing else is going to be moving. It doesn't work that way, right?
Hmm.
So, what I want to do is show you different ways of how you can go into the hip joint, because for some of us, these are the hips are super, super tight. And I'm just going to adjust my camera slightly to show you one thing I think I could see here. So to the side here, okay, you can kind of feel that bone. And that's your hip. Within there is your hip joint. It's called the acetobulofemoral joint. It's also known as the coxal joint. So I just want people to understand the location of the hip. And it is a ball and socket joint. So the head of that bone that goes into the socket is the part that frays. That's what becomes osteoporotic. That's just a little bit of an aside, okay?
Okay.
So, so basically, this is to show for people who, because they're in a chair, just sitting in a chair makes the hips tight, folks. But I can show you how to use the chair to then release that tightness, something you can do throughout the course of your day. And JJ, I know you're in the chair a lot for
Hmm.
work. So it's,
Definitely.
well, let's give you more stuff you can do in the chair.
I
And
love it.
let's give Dawn stuff to help open up those hips for the
She's
type
in
of
the
work.
chair too all day, and you know what we talked about.
Yeah. So let's let's help people with that. So you ready to go for the work? Hey,
Hey,
Marita.
Marquita, welcome. We both
Great
said
to
that at the
see
same
her.
time. We're
Great to
excited to
see
see
her.
you. Thanks for joining. Just in time to get our workout. She knew exactly when to come, right? I have your
Yep.
screen bigger so everyone can see you a lot.
Okay. Now my screen on my end here. Let's see if I can do something. Hold on a
Looks really
sec.
good there.
Good.
Hmm.
Let me just hit enter full screen. But you know what I want to do, darling? Let me just get out of that program. I had another program running. Now, I'm seeing this just a little partially. Let me just see if there's something else. Yes, I think there's another spot that I can hit to make this even larger. Yeah, I just got it. This is bigger than before, so I like it. Great. So let me just get this set. And all right. So good. Yeah, I can see my feet. That's my thing. My thing is I got to see the feet. Okay. So so happy that Mighty Pizza is here. All right, so welcome everybody to Boomerang Beyond Wellness. I'm Angela Fischetti. Thank you so much to Veganology JJ for bringing me back to the show. And this topic is really important to me, and the whole concept of helping those in a chair and not to feel like you're being, I don't know, like stigmatized because you have to be in a chair, right? So let's make that chair useful to all of you. And so hip mobility in a chair. Now, the accessories we're going to be using today will be a sticky yoga mat. Back here, you see a stability ball. We'll be using a yoga strap. Now, why I like straps, yoga straps. First of all, they're between 6 to 8 feet in length. Sometimes they're even longer than that. And they're soft. So for those of you with hand, wrist, finger issues, carpal tunnel syndrome, Dupuytren's contracture, arthritis in the hands, trigger finger, the list goes on and on. This is a much gentler and softer way of working. Then we also will be using a yoga bolster, but I got to tell you, you can do a DIY. All you have to do is take a couple of big beach towels, roll them up, secure them with kind of rubber bands or a ribbon or something, and you've created your own yoga bolster. And then the chair. Now, my chair is an official yoga chair. So you see that there's a window here. There's no backing other than the rim. I like it because I can work around with this chair quite a bit. And then finally, and by the way, the chair, whatever chair you're sitting in, no arms, no arms on the chair, and certainly no wheels. Let's be safe, okay? And then also, for those of you who are brand new to this type of work, brand new to exercise, or those of you who haven't used your yoga blocks in a while, this might be a reminder. So for yoga blocks, this is level 1. This is level 2 and level 3. You can use whatever level works for you. Now, all
Can
of
I
this
ask you a
set,
quick question?
Yeah,
Oh, is
sure.
all of this gonna be in the, store that you
Yes,
that
yeah,
you
it's
okay.
all
I
in the
linked that in
store.
the description, everyone, so check it
Oh,
out.
thank you. That's very sweet of you. Thank you so much. I appreciate that. Yeah, it's this, and it's and mostly you're going to see the stuff that I use myself on that store. Mostly, not 100%, but mostly. So I want to continue with these precautionary measures, and or I should say, I would like to do precautionary measures now and medical disclaimers. So the mat and the ball are typically made from latex. Some part of it is latex. So if you have a latex allergy, you want to look for non latex or latex free. If you have any back, spine, postural deviation issues whatsoever, especially if you've been told not to bend down and pick up something. This is a forward flexion of the spine, spine flexion, back flexion, whatever you want to call it. And those of you who are medicated or not for hypertension, which is high blood pressure, if you have vertigo, GERD, if you have ever had a transient ischemic attack, they're known as TIA, or a stroke, if you have pinched nerve at the neck, if you have rotator cuff muscle issues that are kind of deep to your shoulders, and if you have knee issues, and also carpal tunnel syndrome from the wrist, I'm going to invite all of you and other people who have many other chronic issues to not right away participate with the work. I want you to review it first, to preview the video first. Please look for what you can do. Because of chronic concerns, and especially for some of us, having them for years, therefore lots of pain for years, we get really great at knowing what we can't do, but we're starting to get really closed off to what we can do. So I ask you to look at the video, open up your heart and your frame of reference, and see if you can find one exercise to take away from today. And then go back to my other videos and preview them the same way. Look for the one, because this is how you will create your own personalized exercise protocol. Now, but you might see the video and go, I still don't know. Then I would invite the medical healthcare practitioner who knows your body best to preview the video as well, and then help you make an informed decision. But listen to what I just said, to help you make an informed decision. You're talking about an advocate here, for self advocate for health. All right. So, having said all this, let's move into the work. And I'm going to turn in my chair a little bit because I would like you to see some of what's going on a little bit from an angle. All right. So, I'm going to sit a little forward on the chair. Now, for those of you with back issues, take your bolster and bring it across the chair this way so that you have back support. But I like to be a little bit forward. Now, I'm going to actually demonstrate here first a whole series of movements for the spine. And it's very important in its relationship to the hips. So I'm going to place the hands on the thighs. And when I sit in a chair, I don't want my feet back here because it's putting a lot of flexion or compression on the knees. So if you have knee issues, we want those feet a little bit forward, ankles a little forward of the knees to create space at the knee. And the other adjustment I would like you to make, and I'm not kidding you, this is whenever you sit in a chair, you might want to look around and maybe look around and make sure people aren't staring at you, but I'm going to show you anyhow. You place your hands underneath your butt. Yep, right to your butt. And you pull the flesh straight back and out wide toward the shoulders. Now I'm rocking in my chair because I want to make sure that I'm sitting up and forward on the front edge of my ischial tuberosity. In yoga, we call them the sits bones. We don't want to collapse. We want to be up and forward. So now moving directly into the spine movements. On the inhale, you're going to start to slide your hands toward the groin, roll the shoulders back, really puff up the chest. We have scapular retraction going on now where the shoulder blades come toward each other. Now, you can lift the head, except those of you with transient ischemic attack or stroke, I need the head neutral, whereas the rest of us can lift the head for spine extension. Then on the exhale, I'm going to form a C curve, but not quite yet, because those of you with back spine and postural deviations, you need to return to neutral, whereas the rest of us are going to do that C curve of the spine, place the hands over the knees, and this is spine flexion. This is literally doing an abdominal crunch on all fours. Hold here. And then on the inhale, we slide into spine extension. In yoga, we call it a seated cow pose. Exhaling into spine flexion. That's
That feels good.
good.
Linda said
Inhale.
she needs it. Welcome, Linda.
Oh, great.
I
Good,
do
good.
too.
Inhale, spine extension. Exhale, spine flexion. Stay here. Hold here. I want you to visualize pulling the belly button out the small of your back. Engage that deepest of your core muscles, the transverse abdominis. It's like your inner girdle. And then inhale, we come back to center. Exhale, hold. Now, sitting a little forward on the chair. Be careful. Don't tip your chair. Don't come so far forward where the chair tips. I'm going to bring the hands in through the window of my chair, and I'm going to place the hands on the seat. Now, this position will put your hand like so. This is called wrist extension. It doesn't matter where the arm and forearm are. It matters with the wrist and the hand. This is contraindicated for carpal tunnel syndrome. So you want to hold on to the seat, to the side. I don't care, as long as you're not in wrist extension. The rest of us, we can come into wrist extension. And now really puff up the chest. Careful TIA stroke, head neutral. Scapular retraction, present the heart. You're in a back bend, basically. It's a back extension. Hold here. We do so much forward flexion in life. So let's offset some of that office work and bring in more extension. And then we gently release. And let's take a few moments and just do some nice big shoulder rolls. Not elbow pumps, shoulder rolls. Now, I'm going to turn my chair forward for you. And I want to bring in what's called lateral flexion, side bending, okay? So I'm going to get back in the chair, and my right hand goes to the outer leg of the chair, holding on, left hand to the waist. So, JJ, is the sound still okay? Do you hear any crackling or anything?
I don't. Do you?
Okay, no, I'm
Okay.
fine. I just want to make sure my microphone doesn't act up.
I muted
So,
it so that I could only hear you on my end. So if you have
okay.
any question, just ask me. And I had to come off mic just to say it feels good.
Okay, thank you. So on the inhale, I'm going to slide down, turn the sternum, the breastbone, away from the ceiling. Exhale, bring the arm out and up. Now I'm going to hold here. If you have a pinched nerve at the neck or rotator cuff muscle issue, this might be as high as you can go. You can also choose to keep your hand at your waist. However, don't do this thinking you're going over further. It's going to aggravate your shoulder, all right? So for the rest of us, we can go up and over. Now, I turn the sternum toward the ceiling so I am not collapsing the side organs. And I'm connecting the energy from the left middle finger to my left heel, stretching the intercostal muscles between the ribs, responsible for 25% of your respiratory cycle, and your internal and external oblique muscles, which are core muscles, basically responsible for turning and twisting the torso. Inhale, turn the palm up, grab a hook. Exhale, push down into your left heel, vigorously reach out. Now, I'm not going to talk for the moment because the microphone is going to come close to the mouth and it's going to be garbled. So I will be taking it over to the other side. So we slide down, sternum turn, and now I'm going to go quiet. Inhale, exhale, push down into the heel, vigorously reach out, come back to center. Now I'm going to sit forward a bit. Let me just bring this back a little bit. Yeah. I'm going to bring my feet as wide as the legs of the chair, hands on the thighs. And I'm going to do what's called a Sufi grind, which is a spine rotation. Now, those of you with back spine issues, that's too big of a range of motion. You're going to keep it small, just making a little circle on your pelvic bowl, literally, okay? So otherwise, for the rest of us, well, this is my spine extension. This is my lateral flexion. This is my spine flexion, my lateral flexion, my spine extension. You see how rotation is a blend of the moves. Oh, feels so good. And then I'm going to reverse. So it's coming from that back, hip hinging at some point here. One more. It's a beautiful release to that back. Now I stay here and I lengthen forward to come up. You can choose to roll up if you wish. So we've done all of the movements here for the spine. And now what I'd like you to do from here is bring your legs wider apart. Now we're moving into hip. So this is hip abduction, abduction, meaning going away from the midline of the body. But I'm also externally rotating, also known as lateral rotation, the hip joints. So you're doing both here, pressing the thighs open, thrusting the chest up. Feet are turned out and just hold here. Now, you never want to push too hard on your thighs if osteoporosis diagnosis is in the hip joint. Now, I'm going to bring the ball into play. So, back spine issues, you're going to stay upright. Postural deviations, you're going to stay upright and just work on this part of the movement. For the rest of us, hip abduction and also hip lateral rotation. I'm going to add in now spine flexion. Gently walking the ball out in front. Belly button is in. Make sure you don't tip the chair. Don't want that to happen. Hold here, beautiful back stretch. Now notice the head is lifted. So if you're medicated or not for hypertension, you have vertigo, GERD. I need the head up, not this, okay? I need the head up. And then from here, I'm going to walk the ball over, belly button in toward my right toes. Hold here. Using my left hand to push the left thigh down, the hip down. Making sure it's not popping up. Stretching the lateral side here. Also stretching the quadratus lumborum of the low back. That's a very tight part of the body on people who sit in a chair a lot. And then I'm going to go back out front and just re-experiment. Can I go a little further? Can I go a little deeper? Reaching out. I just got a spine adjustment here. Linda L, hello. I need this. Good. I needed it today too, Linda. Thanks. And we're going to walk the ball over to the other side. This is my tighter side. Oh man, do I feel this stuff. Turning toward the ball. Now, when you do all of this side work, so this is a seated wide angle in yoga. They call it Upavishta Konasana. When you do side work, it's referred to as side or flank. Parsva is the word. And then we're going to bring it one last time out in front. Keep that head up. I like to have the cervical spine of the neck, the lumbar spine of the low back doing the same, holding the same position, because they both have a natural lordotic curve that actually lends itself to back bending. So what I actually think here, because there's oppositional movement in yoga at all times, is I'm creating a back bend in the forward bend. And then draw the ball toward you. Work the core muscles to come back up. And then I'm going to remove the ball here. And I want you to see something, because a lot of people have, I don't know if that ball is going to stay. Okay. A lot of people have really super tight ankles, right? So notice I'm lifting the balls of my feet, turning the feet in, lift the heels high. I'm heel toeing the feet closer together. I told you that would happen. So let me put the ball over here. Otherwise, I'm going to be having a little bit of a challenge with the ball.
We're just having a ball here.
You're
Can you
having a
do
ball.
this without the ball, did you say?
Did,
Or should you do it only with the ball, like all that movement?
Well, the ball makes it flow much more easily from side
Okay.
to side like that, right? Because I'm looking for the fluidity of the movement. Of course, you can do it also to reach out, but it's a different thing when you have an object that can move with you.
I love
Now,
that ball.
let me just see where I'm at here. Okay, so now I'm going to sit back into the chair a little bit. I don't like to go all the way back into the chair. And I'm going to grab my yoga block. You can use a pillow right now if you don't have one, okay?
Okay.
And I'm going to put that block between my knees. Now I'm working on hip adduction. That means going in toward the midline, and we're strengthening those inner thighs. We're going to be doing some twisting here. Now, those of you with the back spine postural deviations, especially osteoporosis and perhaps other conditions where you've been told to keep your twisting to a minimum, I have to tell you something. Twisting is a natural movement. Even if it's this small, just think about it. If you're sitting at your dinner table and you're going like this and you're grabbing stuff from you're twisting, okay? If you're washing your dishes at your sink and you're putting them away, you're twisting. That's not big dramatic movements. That's just natural movements. So for the back spine and postural deviations, I'd like both hands to the outside of your right thigh, just your thigh. Because when you go to twist, it's going to be a tiny twist, a short range of motion. Whereas the rest of us, left hand to the outside of the right thigh, turn your palm on your right hand toward your face, inhale the arm up. Now, externally, laterally, rotate the arm. It may have crackled there, I'm not sure. And take a hold of the chair. So I went through the window of my chair and I'm squeezing the block. Inhale, you push down into both feet to lengthen your spine. Exhale, you turn and twist. Now I'm going to look at you so that it doesn't crackle the microphone. When you turn and twist, don't force it with the arms. You can actually literally pop a rib that way, all right? Don't make it about muscling it up. It's got nothing to do with that. You pull your belly button in to create more space for the twist. And then inhale the head forward. Exhale, torso forward. We take it to the other side. You know your contraindications, right? For the rest of us, right hand outside left thigh, left palm toward the face. Inhale the arm up, roll the shoulder back, and take a hold of the chair. Inhale, lengthen spine, press the feet together. Press the knees together. I don't want the feet touching each other. Your knees are only as wide apart as your block, ditto your feet and ankles. So we lengthen, inhale, exhale. It's like you're presenting the heart, turning and twisting. So we call this in yoga Ardha Matsyendrasana, which means half spinal twist, half fish. We're squeezing the block, still strength training those hip adductor muscles isometrically. And then inhale, head forward. Exhale, torso, arm forward. I'm going to set the block down. I like and suggest oftentimes that if you have the props are small enough, put them underneath your chair. So now I'm going to sit all the way back in the chair. If you need your yoga bolster, put it behind you for your back, okay? Now, on this next one, we're going to work on hip flexion. So we're going to interlock the fingers. However, if you're medicated or not for hypertension and you've been told not to squeeze the fingers, then you place one hand on the other. And I'm placing my hands underneath my right thigh. I push down on the left, inhale, exhale. I pull knee to chest. Now listen to what I'm saying. It's knee to chest. People do this and they think they're in hip flexion. They're not. They're in hip abduction. So toward the chest. Now I can tell you that oftentimes males are very, very tight in the hip for flexion. So what you can do is just lift to the height you can handle. Don't veer off thinking you're getting more hip flexion. You're leaving hip flexion. With your block, okay, because some people are this tight, you can put your foot on the block and I have the heel lifted. You see how I'm up on the ball of the foot. So that's still hip flexion, so you can use support. So I push down on the opposite to lift, hold here. And I want a little knee swing, little gentle knee swing. I'm not kicking, I'm not punting a football. It's just a gentle knee swing. And if you have the mobility and the flexibility, you can put your heel up on the chair, wrap your arms around, hug the thigh toward the chest, push down on the left to make sure your spine stays nice and tall. You could also play with this and alter the grip on the elbows, but if you have knee issues, I wouldn't do it. I would just stay with this, all right? Particularly for those knee issues. Hold here. And then I support behind the knee to gently lower the leg down. Oppositional movement, push down on the right, interlock underneath the left, and lift. Little knee swing. Let's send the knee joint a little love. Or up onto the chair. You want to sit tall. You don't want to slouch back into the chair, right? We're going to wrap around, push down on the right to lengthen the spine, even pushing down on the foot that's on the chair to help you lift that spine. And then opposite arm crosses, nice and tall. Are you breathing? We want to make sure we're breathing in and out through the nose, but some of you might have COPD, chronic obstructive pulmonary disease. This would mean that
Hey, Dawn.
this would
Hey,
mean this would hi this would
hey,
mean, so for those with COPD, you want to talk to your practitioner about utilizing pursed lip breathing. So then I support behind the knee to gently lower this down. Now, we're going to still work unilaterally, one side at a time. So I'm going to bring my left leg over just a little bit wider. Is there a way to change the view where Dawn is above you, Jen?
Mm-hmm.
Can we move Dawn's? Is there a way to move the view?
let's see here.
How about that?
Yeah, how
Great.
about that?
Thank you. Perfect.
Yeah,
Dawn, by the way,
yeah.
before I go further, our session inspired this routine. You and I, what we talked about. So
Oh, nice.
this about your the hips, okay? So
Yep.
now we're going to interlock underneath again, but we're going to bring in two more movements of the hip joint. We're going to bring in medial rotation, which is internal rotation, and lateral rotation, which is external rotation. So I push down to lift. Here we go. Medially rotate, laterally rotate, internally rotate. It's a sideways number 8. A sideways number 8. What's guiding me here? I move the hip, but I'm looking at my knee to make sure I'm creating that sideways number 8. What we don't want to do is this kind of stuff. You just got to hold yourself up. So if it's too much to hold your own leg, you can keep the ball of the foot down and roll in and out that way as well. And I'm going to lower down, keep the foot out wide. Do the same on this side. We first come into the hip flexion and then medially rotate, laterally rotate, internally rotate, externally rotate, sideways. Number 8. We are really, for lack of a better description, massaging the joint, folks. We're getting the fluids in there, your blood, your lymph, your water, literally your nutrients, and then place it back down. So this whole time you can still be working with the bolster. Now
That
I'm
felt
going to
good.
do, it's good, right?
Yeah.
Good, good. It's a beautiful way to
You should
release
see the
tension.
beginning when you have a chance. Look back at the first beginning part to that back thing she showed us, both like me and I was just like, oh, this feels good. I had to come off mic and say it.
Okay. So now we're going to tie in a little bit of strength training. Okay. So you're going to hold on to the chair, the legs, the seat, whatever works for you, but sit back into your chair. We want to lift your legs like so, straight up. Now, the foot, I'm going to go like this. The foot, this is called dorsiflexion because the dorsal side of the foot is the top side of the foot is coming toward my face. If I were to point down, that's plantar flexion because the sole of the foot is the plantar side. So we're holding here in dorsiflexion. The legs are straight out. The heels are off the floor. If you can't get them off the floor, you work at it. That's okay. Now, we open out the thighs no wider than your seat. So this is hip abduction, abduction. Going back to midline is hip adduction. So you're going to breathe in and out through the nose. Whichever one is more challenging for you personally is the one where you'll exhale, because we exhale on the effort, EE. You want to make it more challenging, don't hold on to the chair. But you got to make sure you have a strong back, that the belly button
Ouch.
is pulled in, belly button is pulled in, and we don't want to slouch. No slouching permitted. All right. And sometimes if you have to bend the knees and open and close, sliding your feet in and out, that's okay. That's hip, medial, and lateral rotation. Give me a few more repetitions here. I call this scissors, abduction, and adduction. So basically what we're talking about here, Dawn, is creating a friend out of a chair. A chair is not an enemy. To make it a friend through exercise. Now we're going to lower the feet down. Now, check this out. I'm going to turn on my chair here. I'm coming so far out that my outside buttock is not on the chair. It's just the inside butt, the one that's closer to my white backdrop. I've got to hold on with that back hand, okay? I don't need anybody falling off your chair. Get that inside on that chair, okay? Now watch here. I lift up super high on the ball of the foot. Dawn, this one is for you, okay? So what we're going to do now is slide that leg all the way back, push back. Now I use my hand to push that hip forward. And if you notice, I lifted and pulled the opposite hip back. So I just squared off the pelvis and the back. Now I'm in full hip extension. When we do hip extension, the gluteals are working. The hamstrings are working. The quadriceps are working. One is stretching. The other one is contracting. We have the back extensor muscles working. This is an enormous position. Now, if you feel like, hey, I feel pretty confident here, then you bring that outside arm up. You create that back bend. Watch it. TIA stroke. I need the head neutral. The rest, go for it if it feels comfortable. Some of you might not be able to go that far back. That's okay. That's perfectly all right. Now, if you feel super balanced, if you have vestibular challenges with your balance, don't do this next movement, please. Bring the opposite arm up, reach up. Then you can bring the hands in what I call a steeple, where you bring, except your index fingers and thumbs, the rest of the fingers are interlocked, and take it up.
That feels good.
And
Neo's
then
even doing it with us.
inhale, hands to the heart.
Mm.
Exhale, soften the top of the foot. Let it go. Gently slide it forward. Move onto your seat before you turn around because you could
Ah,
fall, right? Who was doing it?
I
Pat
did it.
jumped up on it and
Right?
did it with he looked like he was doing it right along with you. He jumped up on the back of the chair like, "What are you doing, Mom?"
I love it. Okay, so we're going to turn the other way, outside cheek off the chair. But don't let go of that chair with that hand, okay? The inside cheek firmly on the chair. We lift the heel, slide the leg back, slide it, slide it. Now, outside hand is going to self-adjust. Push that hip forward. I lift it to pull the opposite hip back, and I get a deeper stretch that way, folks. I get a deeper stretch. Keep the chest lifted. Now, I'm not going to talk with the arm up there because the mic is going to be right near my mouth. But what I'm going to do is, because I feel comfortable, bring the arm up, bring the other one up, or you can join us on the steeple or just stay in this position with your hand on your waist. Here we go.
Mm.
Inhale, soften, exhale, slide it forward, scoot back onto the chair, and come forward. I'm going to go into a wide-legged Sufi grind. This is the spine rotation, feet wide, and I'm going to make my circle. I'm going to make that circle. Remember, we talked about it before, back spine, postural deviations. I need a small circle, reverse direction. It's just so lovely the way it frees up the back, the inner thighs. Whew. One more hold here. Your choice to roll up, or I'm going to choose to push my hands into my thighs to allow me to lengthen the torso to come upright. So let's play with it again. Toe, heel, exaggerate the movements, make them big, folks. Now, from here, I'm going to grab my yoga blocks and I'm going to stack them one on the other like so. Then I bring the sides of the feet onto the blocks. So if you have some sturdy books or something, you can try that. So now,
I have a
what I
quick question. How high, like, do you have a recommendation, like how far off the ground should our feet be touching when we use the chair, like up properly? Like, can we put both feet on the floor? Like what's too high of a chair to use for this, or is there?
I don't know the height because that's based on the leg length of the person.
Okay, so like as long as your legs fit on the floor, like you
Yeah.
can put them flat comfortably.
Yes,
Okay.
yes, that's fine. Absolutely, absolutely. Um, I will tell you that your hip joint should be slightly higher than your knee joint, if that helps. So you don't want your hip joint being lower than your knees.
Okay, that makes sense. Thank
You can
you.
always put a little pillow underneath. It's a great question. So I have the sides of the feet on the blocks. And what I'm doing here is hip abduction away from the midline, but also it's this lateral rotation, external rotation of the hip. Now let's get a nice stretch at the chest. Why not? So you can bring your arms behind the chair and open out and lean back. And it's very nice. And just make sure you're breathing. So this is a variation on goddess pose, also known as Baddha Konasana, cobbler's pose. And then bring the hands alongside the knees and slowly draw the knees together. Now, we're going to tie in some, oops, here it is, some hip flexion again. So I have the feet on the blocks because some people may need to work it this way. I'm going to demonstrate one of these movements here with the strap so you can see how to use your yoga strap, okay? So you take your strap and I'm going to bring it around the ball of the right foot. I push down on the left to inhale, knee to chest, hip flexion. Exhale, straighten. This is knee extension. I'm pulling with the strong biceps. I'm not doing this stuff. A lot of people do this with the strap. You got to work those biceps, folks, so that you can be tall, that you don't harm your shoulders. So that's one way of doing it, okay? I'm going to show you another way. And what you want to do is, for those of you who know yoga, you take your peace fingers, man, and you wedge them between your big and second toe. It's called yogi toe lock. So inhale, up comes the hip extension. Exhale, hip flexion. Exhale, knee extension. So I'm pushing out through the heel, pulling with the strong arm. Now I have to tell you, I'm not comfortable with the opposite foot up there. Some people are though, and you use the blocks if you need. So here we go.
I cannot do that
So it's
yet.
a full lengthening. Use your yoga strap. Use your yoga strap like I showed you. It's not about your height. It's not about your height. It's not about the height. It's about drawing it up and out. Doesn't matter the height, okay? Now from here, we're going to externally rotate and come into hip abduction. So I want to make sure my ankle, knee, hip on the left are lined up. You can bring your opposite arm out and reach. I'm pushing out through the right heel, pulling with the strong right arm. Hold steady here, getting these adductor muscles stretched, your hamstrings, your calves, and it's really great. Now, the act of returning to the midline is hip adduction, ADD. So what I'm going to do is take my left hand to the outer arch of the foot. Inhale, right arm up. Exhale, arm out behind me. Now I'm going to go beyond the midline. It's a big stretch in the glute and the lateral rotators with deep to the gluteal muscles. So if you have piriformis syndrome or sciatic issues, this is a great stretch. Now I'm going to turn my head and I'm not going to talk because the mic is right there. So the name of the pose is variations on something called Pada Hastasana, which is hand to foot pose. So inhale, I bring the knee back to the chest, hip flexion. Exhale again, knee extension. Now I can bring it higher. Push down into the left foot to lift the right. Elbows are bent. Pulling from the bicep. And then inhale, lower the foot down if you need to your block or to the floor. Exhale. Other side now. Yogi toe lock or strap. JJ around the ball of the foot. You push down on the right, lift the left. Hip flexion, inhale. Exhale, knee extension. Now, yogi toe lock, it's a different name for the pose. So let me get a grip on this. So this is hasta, meaning hand, padangusthasana. Foot,
Oh, wow. I'm glad you did that.
foot, big toe pose.
Vaughn, I know, right? I'm like, I cannot. She's making it look like easy to do
I'll
that
be right back. My
extension.
boss was texting me something, but yep, I'm listening now.
Okay.
I'm gonna do this on my lunch. Hi,
Yeah,
Vaughn.
this sounds
Welcome.
good.
And
Vaughn,
the
Linda,
opposite,
Better
Mariquita.
Vaughn, what's up?
on, and the opposite arm comes out. That helps to stabilize. Remember to bend that left elbow. Now hip abduction and external rotation. Now we come back to hip adduction. Let's take right hand, outer arch of the left foot. Inhale, left arm up. Exhale, spiral it out behind you. Turn and twist. Look over the left hand. So I'm reaching out through my left heel and my left middle finger. They're reaching away from each other. I'm going to go beyond the midline. Oy, oy, oy. I'm telling you, this is such a big stretch in my gluteal and lateral rotator muscles. Again, very good for piriformis syndrome and sciatic issues. Inhale, head forward. Exhale, I rebend. I'm grabbing the inner arch. Inhale. Exhale, take it up. Let the elbows bend. So we're flexing the elbows. That means the bicep helps. It distracts from the shoulders taking over. And then inhale, bend the knee. Exhale, set it down. Let's release the hips again. All right. Let's release the hips. Interlock underneath the right thigh. Lift up. And we're going to do those hip rotations. Now, remember, if you have to do it small, as long as you're making a circle from the hip joint, you're still going to get the benefit. Reverse direction. On my store, JJ, that the stuff that I choose is the stuff that I use, but there's just a couple of larger items. The workout bench I've never used because the one that I use is not being sold any longer. So when I go to pick something, I go to pick what has coupons with them
Okay.
and also what they're made out of. The stuff that I use, mostly it's really what I use up there. And
That's
I'm going
good
to
to know.
reverse direction. Reverse direction. And we have one final movement. I think you'll all like it.
What's the cost of the yoga bands roughly? Do you know? I think
I
someone's
can't guess the
asking.
prices offhand. I can't,
Okay.
but they can find that because they're very
The link is
clearly,
in the description. So
yeah,
if you
it's very clearly there on my shop fitness tab. Thank you for asking. So I'm going to bring the legs, the blocks out in front, stacked. And it's our final relaxation. You all deserve it. So I'm sitting back. You can use your bolster behind you or your DIY. And you put your heels up on the blocks and just let your legs relax. I'm going to soften my hands, one hand on top of the other. Right palm is on top of the left, but the palms face the ceiling. And let's just take a moment to close the eyes and just focus in on the breath and take a moment to express gratitude and appreciation toward our bodies for working so hard for us, and gratitude and appreciation for good health, and perhaps sending someone in need love and light, and expressing gratitude and appreciation for Vegan Knowledge JJ for inviting us here today to basically practice our stretching, practice our meditation, practice our wellness, and share it with each other. And let's relax the arms down, relax the legs. Take a couple of nice big shoulder rolls, not elbow pumps, shoulder rolls. Thank you, Vaughn. And that's what we have for you folks today. I'm going to walk toward the camera now and readjust it.
thank you. That was
That was
great.
amazing.
I know
Thank
Dawn
you.
loves yoga and we
I
have
do.
thank you everyone for coming and thank you
I
for the
promise
beautiful
you
thank
that
you.
you inspired me, Dawn. You inspired
Yeah,
me.
really?
And seriously, and what I want you to do, because on my YouTube channel, I have a part one. The part one is not the movement. Part one is, I think, about 10 or 15 minutes long. It's about the anatomy of the hip joint and the muscles involved and stuff. And I think I like for my students and clients to have a little bit of a better understanding of what goes on anatomically, so then they can appreciate, why are we doing this? It's got this,
Right.
This
that. And
my
then you
spine
understand,
feels tingly.
yeah, isn't that nice? That's like blood, man. That's the oxygen. That's just the movement. It's amazing how much you can do in a chair. The chair is not the villain. It's just the amount of time one spends in it. And like I said
Right.
way earlier, like we discussed way earlier, if you've got health challenges and you must be in a chair, you cannot be condemned for this. So let's teach you how to do stuff in the chair.
You know why I was so interested in this when I was on at working at my first call center job in like my 20s, I would take my chair because I would work out before I went to work, and I was really into, like, keeping my body, fit, which is where I wanna get back to. I tend to be right on the right track with the diet, but I need to work out, and I would move my chair, like, I would take it and go like this, and I felt like it was working my upper thighs, and I'm like, "That's the only thing I knew how to do." And I'm like, I'm so excited for this because I really need to stretch, and I'm at this desk like all day, half the night, a lot of times working on stuff for the channel and my part-time job. So I'm like, this is perfect. I can't wait to, and I
Good.
think you've inspired me to do yoga. I've never done a whole session, and being in the chair made it feel like, okay, I can do this.
There you
Yoga's
go.
amazing.
There you go. A lot of people get on the floor with yoga and they're like, now what? So get in the chair, man. Get in the chair and do some movements in your chair. But
That's
that
a good
Dawn,
one.
that session we just did is very helpful for people who spin, because spinning really messes up the hip flexors. Let me just move these blocks so I don't trip over them. The hip flexors, okay,
Yeah.
right? So you've got to open them up. Otherwise, you're going to wind up like this later on from spinning. You're going to be like this because these hip flexors pull us. So we want to do the extension phase, all that extension stuff,
Wow.
to help you
That's
build it.
already starting. You know that?
It's
Wow.
very immediate. It's very immediate. But the thing is for that, when you
I
want to
found
do
myself
sport,
standing like that before. And I'm like, wait a minute, what am I doing? And I stood up straight.
yeah, there you go. And when you when you want to do a sport
Wow.
that is repetitive, and it's repetitive with certain movements that can be harmful in the long run, it doesn't mean it has to be harmful in the long run. You just have to balance it out to understand what's going on in the body. So it's like, all right, I got tight hip flexors. Well, guess what? Let's stretch them out a little bit. Not overkill, because that can be a problem. You can actually make them tighter from going into overkill. You always want to monitor your stretches, Dawn, with breathing. So
Okay.
if I can breathe in and out, and if I can chat while I'm stretching, I'm in good
Mhm.
shape. But if I'm doing this with the stretching, and I'm telling you, people in yoga do this stuff. All right.
Dude, I make a practice of doing breath work while I do yoga. So I'm glad you said that. So I'm doing the right thing then.
Yes, you want to, because
Awesome.
it's when the breath stops in yoga that you pay attention and go, wait, I'm beyond my edge. I'm beyond my
Right.
edge. So I have to correct that. So you're on it. You're doing it. That's great. I just grow
Oh,
concerned.
sweet.
Always grow concerned for people who cycle and people who in particular.
Did I lose sound? I
Yeah.
lost you, Angela.
Yeah, we lost your sound.
Lost my sound.
Oh,
There you
that
go. You're
Oh,
returned.
okay. Must have been a moment there. Sorry about that.
it's okay.
Am I back? Am I back?
Yes.
Back.
Okay.
You're
Sorry
good.
about.
No,
Okay.
that's okay. I
I
just
might.
wanted
I'm
anybody to miss
wondering.
all your knowledge.
I'm wondering if the battery's dying. Let me check something.
It's weird. It was only a second. I'm wondering, Dawn, was it us or did everybody in? Yes, Marakita, that is spinning. And the only reason I knew that is because they used to have like spinning class, I think it was. She
Hmm.
was asking, is spinning riding a bike?
Yes, and oftentimes, Marikita, people will do what's called climbing on the spin bike. So they'll stand and pedal. Could you imagine the amount of flexion in the hip joint there and on your knees as well? So you want to do stuff that's a little dicey. I'm cool with that as long as you bring in the balance to it. Is there any other questions from the audience?
Let me check. Well, someone said, Vaughn said I need one of those big balls she was using earlier. Yeah, I'm gonna hit that store up as soon as I'm going in my own description after I get out of here.
And also, there are a couple of things on there that
Yoga
are
bands. I
great.
need those. That was another thing. That's what I was gonna ask you. What is wrong with my leg that I can't? It seems like my leg would not stretch out to do that pose you were doing, or did that take you a while to get
The
to
leg,
that?
the
The
leg
leg
straight out.
extension? Yes, with my
Right.
arm
Okay.
touching it. I
So the thing is that's very indicative of tight low back, tight hips, tight hamstring, right? So what's wrong with this? Pull back a little. So I'm going to bring a block out in front of my right foot. Okay. No, I got to go further back because I need you to see it. Okay. So my heel is up on the block. All right. You get that out there. So you can kind of a little bit see. You know what? Let's do this. Let's see. If I turn that down a little bit more, then you'll see it better. Yes. Okay. So I'm going to take a strap, my yoga strap, out here, strap around the ball of the foot. Push down on the left, inhale, lengthen spine, exhale, and I just start working it this way. And I'm eventually inching my hands down lower and lower, but that doesn't happen in the beginning, right? I'm going to go to the point where it's acceptable, where it's tolerable, the stretch. There will be points people try to go into the struggle. The struggle just creates more struggle. It just
Right.
creates more tightness, right?
just like
So
life.
it's the same crap. That's it, girls.
Yeah.
Exercise is absolutely a microcosm of what goes on out there. And then you could try, and you would do it on the both sides like that. There is on the shop, I have a yoga kit there. There's a mat, blocks, and a strap. People are much better off if they're considering buying stuff. I'm talking about in general, if they're looking to buy blocks and they want to buy a strap, don't buy them separately. Just get them in one package deal because otherwise it's just too expensive.
Linda
For
said,
those
"Thank you.
for
I missed that."
those
I
who
think she was
need
talking to you.
for those who need it, right? So here we go. We inch into it and the hands come further down, right? Because eventually the hands are here, but the chest is up. Does that make sense,
Mhm.
JJ? All
It
right.
definitely
Yeah.
does. I'm
So
gonna start working on that.
yeah,
And
very important, very important. But you need to also tie in
Uh-oh.
lost you again. There you are.
who me?
Yeah, just for a second it blipped out again. I don't know if it was the way you moved, maybe when you did the stretch, I think. I was wondering too, like, is it anything I can do, or did I just already, like, from running on a lot of hard surfaces when I was young? I feel like sometimes I can feel stuff moving in my knee, like almost like, when you bend it, like you can feel, is that like cartilage or something moving?
I don't know what's moving inside there. It's very possible. It could be
Like,
ligaments. It could be ligaments. Okay.
mhm.
But you want to get that checked
Okay.
because you got to make sure there's nothing going on with the kneecap,
Okay.
right? Because the kneecap can it can be like misplaced within the knee joint. It's not officially attached. It kind of floats around.
Mhm.
Yeah,
So
that's what it feels like's going on with me.
right, you want to make sure that you're healthy within that joint. So it's something to just
I
tuck
could
away
just
in your
use a
mind.
cap for my water bottle, it's okay. I'm just kidding. What are you gonna do with me?
I love it.
Anyone that have any other questions for and oh, I did, see a couple more. Oh, okay, yes. She was saying, hers always pop when squatting down, and
Mhm.
I have achy hips sometimes. Marquita said I had bursitis in my hip. Okay. We
This is
could
good stuff. Good. This is good stuff for Marikita because she sits too a lot.
I think everyone like you said, it's like a all or nothing thing. Like you need to get up from your chair and you need to go work out. I think what you gave us today is, because I know a lot of guys are here from Dawn's stream in her stock trading group over at ADT, and I think they are definitely trading stocks. So they're at a desk.
Yes.
I mean, like at work, I can stand up. I do for periods of time when I'm waiting sometimes for a customer, but I have to type while I'm, doing it. So it's really hard unless you have like an ergonomic desk to be
Right.
standing up and stretching while you're working because you have to, and you're leaning over. So I think that's why
Right.
that back thing felt so good.
Oh, definitely, definitely. When I used to live in New York, I used to get hired by companies to come in, particularly, believe it or not, legal firms, to teach them exercise in the office because they were just like everything was killing them with the hips
Wow.
and all that stuff from all the sitting. And
Mhm.
I've worked with, like, in dental conferences. They would bring me in dental conferences to do chair yoga. I'm not kidding you. We would have a couple of hundred students in there, which gives you an
Wow.
idea. They were all dentists and dental hygienists because they're a mess from the work. It's all hunched over. It's constant, right? And they used to, like, at their conferences, they wanted their breaks to go and do yoga. They badly needed it. And a lot of this is all just based on repetitive stress. And
Mhm.
just have to figure out how to tie in some of the movements to offset it if you don't want to have stuff later on in life, because it really won't escape you. It will not escape you. And there's stuff that we can do now to offset injury down the line, so to speak, or chronic pain. And
Yeah.
how you execute exercise, by the way, is very important to prevent inflammatory processes, because if you exercise incorrectly, you will create inflammation in the body. And exercise is supposed to do precisely the opposite. But too many people are rushing their exercises. I watch stuff on YouTube and I'm like, when did it happen?
I bet that's hard for you to watch sometimes, right?
Well,
When
I
you're
mean,
watching
sometimes
it.
it's really great and they're great people that I watch, but sometimes I watch and go, when did as fast as humanly possible become the only desire
Yeah.
Right.
instead of how you're executing something? I don't get that mentality. It's a human body. It is not a machine. People talk about it. Oh, it's a machine. It's like a car. No, it's not. It's flesh and
Right.
blood, baby. And you better treat it with respect, because the other way, you're just doing a great big old dishonor. You
Yeah.
honor,
Just like how
you know?
important it is what we put into it, and then how we do the inflammation completely goes away usually, when you work out and you couple it with foods that don't cause inflammation. The body is wants
Yeah,
to heal itself, right?
yeah,
You and
that's
Dawn
right.
always say that.
That's right. And I'm going to say one thing though. If you eat a certain way, but you exercise a lot, well, that's really cool and that's beneficial. But you do hear about the marathoners who drop. And because a lot of people think that they can eat crap and they're going to make up for it from
Working out.
exercise. Well,
Right.
guess what? You're putting more stress on your body systems, your heart, your musculoskeletal systems by eating the crap and then beating the crap out of your body without it really being able to properly nutritionally recover.
Mhm.
So that's why when you hear our vegan athletes, um, particularly those who really eat whole food, plant-based, and not a lot of them do, by the way. There's a lot of vegan crap going on with the vegan younger athletes. When they embrace healthier food, it's your recovery process that's phenomenal. That means your
Mhm.
body kind of has those tendencies for that inflammatory process. But then if you do something, Dawn, like yoga, right?
Mhm.
You are absolutely allowing all of that to calm down and give your body a chance to recuperate. And you can go hit it hard another day.
That's what I do yoga right after I work out.
That's the way to go. Let me
Stretch
tell
it
you.
out.
That's
Yeah.
the way to go.
That's really cool. I think it was,
Wow.
Chef Babette, right? I heard her on a show today and on Misfit Vegan, and she was talking about how important stretching was, and she wished she had
Ooh,
stretched when she was younger more, a
yeah.
lot, and she didn't, and she paid for it later on. Her trainer told her, "You need to start stretching." So that's really good, information you gave us there. W-
I
What is
remember Chef Babette remember I'm 65 and she was in the raw movement and I was in the raw movement. I remember her from way the heck back.
That's so
Yeah,
cool.
she's awesome. She's awesome. She's hilarious too. She's awesome.
So what do you think is important? Like, what if you want to like start, but you don't know where to start? Like, which video would you recommend if you're new? You don't have any real like, um, pre-existing, let's say, health conditions, and you're just in you're over 40 and you want to start working out. Like, which of your workouts would be best?
I would say to introduce yourself to the warm up and cool down video because those are very important. Those are super important to know how to warm up your body prior to working out and how to cool it down and basically stretch it out, right? Then you can just go into something that's more like a total body workout if you want. It depends upon the person's desires and goals. But
Hmm.
every single one of the workouts, no matter what, is going to address chronic conditions. Every single one is.
Okay,
Now,
good.
however, there's also going to be with every single one, you can do them as beginner, intermediate, or advanced.
That's cool.
All right. That's what's important to understand. But if I'm just brand new to exercise, I want to know how to approach it safely. So therefore, I would look at the warm up and cool down video. And then if you're dealing with like, okay, you're an office person, I think I got to figure this out. Okay, so then they're on there. I have chair exercise, I have chair yoga, I have this hip mobility class. You can start with that stuff. Or if you're somebody who's more seasoned at working out, then you're going to
Mhm.
go, I'm going to tell you, why don't you go look at my squats? I have a whole thing on 98,000 squats, and you'll work, baby. And but you might be the one who needs to do it without the weights, and somebody else might be the one who needs to do it with the weights, and you have those options. There's also another one called compound movements. If you're a bit more intermediate to advanced, you can try that because that's going to take. We did, I think, a compound movement session on vegan knowledge last time,
Hmm.
Jacob. And what compound movements are exercises that work the large muscles, multiple large muscles, and multiple joints at the same time. They are tiring. The squat workout is tiring. So you have to
Yes.
gauge yourself, right? You have to gauge yourself. And then if you're somebody who says, well, I don't have any weights, well, then I got stuff on there for bands and tubing. So there's total body workout with bands and tubing, and how you can work with those. Um, so I try to provide a variety of approaches. Some people like two body parts at a time. Okay,
Hmm.
so we got delts and biceps or whatever the heck I have. You know what I mean? Biceps, triceps, back, chest, whatever. I'm going to be
Right.
I'm going to be filming stuff in the future, like I'm going to do push pull exercises. Just different approaches, different concepts for people because people are at different levels. Um, may not even be current with their exercise, but they may know a lot about it. And a lot of times people are returning to exercise after
Yeah,
decades and they still know a lot about it,
but
right?
they can't do what they used to.
Right. And that's
Or they
also
don't think they can.
well, that's also very important, though, to come to terms with where you're at in the moment in time, because you will be your worst enemy and you will get hurt if you're not. You have to come to terms with where you're at and what is appropriate for you in that time. That can change. The more consistent you are with your efforts, the more you're going to really reap the rewards and the more you better understand what your body is capable of. Be very careful of somebody else telling you what you're capable of.
Mhm.
That's a good message. And what
Very good
like
point.
what I think for me, I want to like I want to like build some, I guess you would call it toning. I'm not necessarily thinking muscle because I don't need to be like super muscular, but I
Okay,
want to be
we're
fit.
going to back up. We're going to back up. There's no way you're going to be super muscular.
Okay, good.
It's not in your
I'll
DNA.
be picking up Dawn.
Look at your physique now,
Mhm.
right? And you're not going to build up muscle like a muscular physique, but
Right.
you want to build muscle for
Yeah,
strength. Got it? For
that's what I
strength.
want.
And because when you build muscle for strength, you're going to build bone strength. You're at the age now where this is super important as you start to
Okay.
head later in a few years into hormonal changes. So you start that process now so you don't have osteoporosis later on. This is I can't emphasize this enough to younger women. Hit the weights, hit the bands and tubing. I don't care what you do for resistance, but it's got to be an effort. It's not walking the dog in the park. For some people, that can be effort. For some,
Mm.
that can be. I'm not kidding you. Okay. But if you're not at that point, then you must get breathless, acceptable level of breathlessness when you exercise. I can speak, but I don't want to. Okay. That's
Okay.
where you want to be when you train. You want to make sure that, well, yeah, that you're in breath, but it's a breathlessness that doesn't frighten you because it frightens some people. It does. Okay.
Mhm.
And to accept that you're going to get clammy and you might even full out sweat. You've seen me here on your show
Mhm.
gushing. I would gush. That last workout, I was soaking wet. You can't be afraid of it. Women of a certain generation were told you shouldn't sweat. It's not ladylike to sweat.
Mhm.
Such a bunch of crap. It's just unbelievable.
I don't think I need to really do a lot to sweat. I've just never been like somebody who sweats really quickly, but so
She's not
I
a
love
sweater. I'm
that.
a sweater.
Yeah, she's a sweater. She'll just sweat from thinking about something that might
I
upset
am
her.
too, Dawn.
Just all of a sudden she says to like fan herself. I'm like, "What are you
It's
thinking
really
about?"
cool during a workout.
That's a
You
good thing.
get that going.
Yeah,
Yeah.
right. That's
I
right.
always am jealous when I see you real sweaty because I'm like, "Oh, she got a good workout in. I need to do that." And Marakita said that the dental assistant's backs can be helped from hunching up even when they are bent over all day. Yeah, that's true. We have to
Yeah.
get up and
So
move, she said.
when you want it, when you're in that situation and you're in your chair, these are the things that we showed earlier. I'll turn the chair to the side a bit. Okay. But this is what you want to use the chair then. Go a little forward, get those hands behind there and thrust up. Just thrust up. Can you hear me okay?
Yeah.
Okay. So you take your back extension that way. And what it does is particularly where now, what I don't want to see is this. I don't want to see, let me turn. I don't want to see
That feels
hunching the head.
good.
It's not this. And it's not about forcing it. You don't want to force it. It's just naturally rolling the shoulders back. I thrust up the chest, then head, the neck is soft. It's not tight and stiff, right? And it just will, it's a counter position to all the hunched over because everything is out in front in life, right? We eat
Phone.
out in front. Everything is out in front. We've got to get the back extension because that's decades from now health.
I'm going to start eating my dinner behind me. Grab a cucumber.
Do we have any other questions?
I don't see any other questions. Dawn, you have any questions for
No,
Angela?
I'm good.
Sure.
Everything is so awesome. And then I can always watch the replay over and over again too and do the workouts with you over from the start.
Great.
Oh, I'm
Great.
doing this one every lunch. I'm telling
Yeah,
you,
I
this was
love it. I
nice.
love it.
This was
Good.
really good for me. And like it
Good.
really, I feel like you might have changed my life right now because I feel like I've gotten that jump start. I've been wanting to get into meditation and yoga, and I
Mm.
just never, got through a session or you know what I mean? I just never do it. And I'm like, now that I did one, you feel like, okay, I see I can do this. It's a nice chair one to begin.
I have one for you for yoga because I have a what I call sleepy time restorative yoga
Oh,
on my
that's perfect
platform.
for me.
And it really is very gentle yoga. But it's just knowing the positions to go into what is conducive to bring on sleep. So this is really done to be well, you can do it any time of the day, but if you really want it to help you for sleep, you do this before you go to bed.
Ah,
Dawn has been a yoga fan for many years, and I'm like, I'm always looking at her like, yeah, I'm gonna do that, and now I
and
got
I
some.
can never get her to do it. But she's finally starting
Very
to kind of
simple.
come into the wanting to do meditation and stuff. So
You had to put me on my own channel, and like, I gotta do this because I want to participate because Angela's doing it, and then it's like, okay, now I'm glad I did. I should have forced myself many years ago, Dawn. Should have
Well,
better
locked me in the room until I did it.
late than never.
right, right. We're ready when we're ready. We hear the message when we need to hear it. And that is it. It's like you can't force this kind of stuff. But
Well,
when there's a lot of information out there, you want to open yourself up to receive it.
Linda
Right.
said, great information. I will replay and do the stretches also. Thank you for the modification on the straight leg lifted in front of the body. Yes,
Great,
thank
good.
you.
Oh, you're so welcome. You're so
Narakita
very
said, thank you all. Love you all, stars.
oh, sweet.
We
So
love
if,
you.
if your audience would be so kind to support my YouTube channel, I'm not quite at 190 yet. I'm at like 187. So I would really appreciate if you would subscribe to Boomerang
Oh,
Beyond Belly
yes. Let's get her to
on YouTube.
300.
So I really appreciate it. And yeah, if you want me to come back another time and do the restorative class for you for the yoga, I'm happy to do it, whatever you guys like. You know, if there's feedback from your audience as to what kind of stuff they would like to see, always feel free to pass that on to me.
Thank you, Linda. She just subscribed to your channel.
Oh,
Thank
thank you so
you.
much,
And
Thanks,
Linda.
go
Lynn.
to the click on all the links in the description. All of her information is there for everything that she does. Her website, the store that she selects everything. Linda, I really appreciate your support. Vaughn, thank you for always coming.
Oh,
Marakita always is so supportive. She has a great vegan empowerment
whew.
coaching. She's great. And Dawn J&J Video Reacts, check her out.
I've been checking it out, Dawn. I've been checking it out.
Have you?
Yeah, yeah. And I don't know if you had seen what I wrote in the comments on for your YouTube when you posted yourself playing percussion. But I was like, yeah, man, she's good.
I did. Thank you. Thank
You're
you.
very
I have
She
welcome.
had
Very.
to take that off because of
figured out on
copyright.
that. I gotta eat some more blueberries because I saw that and I meant to answer back because I like to answer comments back because I don't get that many. So when I get them, I like to answer them
You can
back, you
do it.
I
know?
yelled to her, I
Love
was like, Angela commented on your video. And
I,
you, talking about musicians, your beautiful voice that
oh,
you gave
thank
us that
you.
CD. Thank you so much.
Yes, you have a beautiful voice.
Thank you very, very much. I haven't sung in I don't know how many decades, but it was
Mm,
something I was compelled to do at the time, and especially post 9/11 as a dedication to everyone I knew who passed that day.
that
So
was really
thank you.
sweet.
Very, very
Amazing
kind of
Grace. It was the best, one of the greatest renditions I ever heard of that. I had thought too, like working with you, like with your coaching, it sounds like you give your people a lot of information, which I love. Don't you, Dawn, love that about
Yeah,
her? Like she doesn't just tell you to do something, she tells you why you should do it for your body and how
it's
it's helping.
excellent. It's a lot of people need that. They need the why, otherwise it doesn't motivate them to do it,
Look, if
you
you
know?
have a lot of chronic concerns concurrent, right? You're
Mhm.
frightened. You're frightened. And you're frightened of new stuff, new information, and you got to know that it's appropriate to you. That's it.
Yeah,
That's it. You got to know if it's for you and not cookie cutter crap.
that's it. That's it.
So thank you for saying that because I
Something
really,
that's like, a one size fits all. It's like that's what I love about you. You tailor it to who you're talking to. Like the
yeah.
stuff that you were telling me. Listen, you remembered that I told you that I was dealing with knee or hip issues and stuff before, and you're like, okay, this is something that's going to be good. You remembered that I was spinning and are able to help me with stuff that caught because yeah, I suffer with hip pain from time to time, and now I know why.
She's
You
like one of
know,
those waitresses that wasn't even writing it all down and then remembered your order.
yeah, yeah,
You know, I
completely
remember
awesome.
people's conditions, not always necessarily their names, but I always seem to remember the issue, that is so funny.
Yeah.
I I had a client up in Brooklyn Heights. Oh, she's fabulous. And she was with me for like 10 out of the 11 years I was working there. Okay. And then I moved down here in 2001. And, and a couple of years ago, this very same woman became my client again virtually.
Oh,
And now
that's
she's
sweet.
working with me a
It's
couple of
awesome.
years now, but now I'm 65 and she's 75, right? So it's like, okay, deal with her doctors and what have you, get some information. We pulled it together and now it's the current workout. But here's an example of somebody who she's been exercising her whole life. So she's much more mobile than her counterparts. So, her friends and colleagues of the same age, because her attitude has always been, I got to stay strong. I have
Hmm.
to stay strong, and that's where people benefit so much from
Hmm.
exercise in later in life. And also up here, it
Hmm.
does,
Definitely.
It really affects that. Like, I mean,
it affects cognitive impairment.
that's interesting.
Oh
That's
my
even,
goodness, because
there's so
I
many reasons.
oh my goodness, and because what we're doing there is revving up the body, right? And so the endorphins are getting released, the different hormones are getting released, and it is a wonderful tool to. I mean, when I was in school, I studied. It was disgusting too. I would study reading my books while doing my cardio, so my books were always full of sweat.
I love it.
Always full of sweat, but
The
it
teacher's like,
helped.
wow, you were working hard on your
Like,
homework, right?
what is that? So it helped me to retain the information,
That's
right? To
cool.
grasp it. It really helped me be able to just. It was sort of like narrowed right in on the work and
Right.
nothing else. I mean, I would be in a gym and I wouldn't have headset on, so you'd hear all the music and it was like it wasn't even there. It was me and the materials I was studying I was just like, yeah, man, just revved up from the work of the material and just kept the intensity going. It was You would think it would slow down your intensity, but it doesn't. So it keeps the mind sharp. So
I
when I
can tell because some of those words you were coming out with, I'm like, oh my goodness.
oh
Like,
that's
this is
Sanskrit.
Ashwa Lala Bala or something. I'm like, what?
That comes from yoga teacher training, so you learn the names of the postures
Vera
also.
Vajasana.
Sanskrit. Would you say?
Vera Vajasana.
Yes, 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 yes. That's right.
It's like a
And
warrior.
yep. And Virabhadrasana 1, Virabhadrasana 2, Virabhadrasana 3. So warrior 1, warrior 2, warrior 3.
Yep. Yep.
When I was in yoga teacher training, I learned the Sanskrit names by recording them. And because of my Italian background, at the time I used to speak Italian. I don't any longer, but I wasn't ever fluent, but I was pretty good. And so, because of all the vowels in Sanskrit, I fell in love with the language, which is why I recorded that. One of the reasons why I recorded that album. So, some of the material there is in Sanskrit because it's just these beautiful vowels. And when you're a singer, oh, you love vowels, right? Those are the notes that you can
Right.
extend. And so,
You and
yeah.
Dawn
So,
should duet. She's got a great voice too.
yes, Dawn, stuff, huh? I bet you do. Yes,
She don't like to say it, but I know she does. She's
awesome,
she always says
awesome.
I'm a drummer, and I'm like, yeah, but you also play the guitar and can sing too. Don't
There
forget.
you go, Dawn. Don't knock yourself short there, my friend.
Yeah,
Right?
yeah.
Yeah,
We got to get together one time and do that behind the scenes.
I would love it. That's so fun. Fun stuff, I really
Definitely.
thank you both very, very much for your support and to your audience as well. It's always very sweet experience to work with the both of you.
I love when you
Oh,
come
thank
on. It
you. You
just makes
too.
our whole like week, I think.
Always
Oh,
a pleasure.
Yes,
thank
then I'm
you.
gonna really enjoy this evening and talking about how I'm gonna start my workout journey. This time I'm serious.
Okay. And if you find
I'm gonna
yourself,
keep you posted too.
yeah, if you find yourself lacking or you need a little bit of inspiration or just a little motivation, I'm here. You can contact me. You can always
Yes, you're
reach out.
here. When you're busy, I have your channel, so you're like
Okay.
there. You can be there all the time for me.
There you
Yeah,
go.
check out her channel, Angela Boomer and Beyond Wellness. The links are in
I
there.
don't think I'm
Please,
supposed to,
if
huh?
you're watching the replay of this, subscribe to her YouTube
And
and
subscribe to Veganology JJ.
thank
Is your
you.
name in the title, or is it
No,
Boomer and Beyond
my,
Wellness
my
just
name
on?
is not in the title because otherwise they're going to wind up going to some really old channel of mine. So it's Boomer and Beyond Wellness.
Because we are going to be well boomers and beyond. I think you subscribed already, Don, but you can check.
You know what I did with you guys,
What?
with Vegan Knowledge JJ? I subscribed again
Did
from,
you?
yeah, from yet another account that I have.
Thank you. I noticed I got an extra one. I didn't know who it was. I
That
just,
was
oh, and
nice.
I'm so close to 200. If you're here and haven't subscribed, thank you. We need to both
Really?
be at 200, right? You have
Yeah,
such
man.
important, like, you should be at like 2 million, all the knowledge you have. Like, seriously, anybody
Well,
watching this replay, go do that. Check out the store, support her in every way because she
Thank
cares
you.
so much. What is your final
oh, I
message
am
here?
subscribed.
I knew it. I was like, I
Right.
made you subscribe the first minute I
I
found
thought
her.
so. Yeah, I think you
We
did.
share between channels. I'm like, you got to check this out.
There it is. That's the warm up cool down video. Oh my God.
I love it. I was almost going to use that picture, but then we went with the chair.
Yeah, thanks for
That's a
reminding
cool
me.
pick.
It's crazy picture because I'm into it, and it's like you never know what YouTube's gonna pick as your freaking thumbnail.
I
And
know.
I'm just like, dude,
You can change them. You know
Yeah,
that
but
you
I
Don
can
don't
make
can
know
you.
make you
how.
thumbnails.
I know, but I don't know how to change the dimensions. I tried doing it one time. I was like scared. I just was like, oh God, how do you change this
Dawn
now?
can tell you, like, she has a program that she makes
Yeah,
those, or she can
the
even make you one.
dimensions. I can make you some thumbnails if you want. The dimensions are 1720 by no, 1280 by 720
Hey, look,
for
when I
any
first heard about that, I was putting my thumbnail up there and I didn't understand why no one was clicking on my videos. I'll stop. I'll stop. It's getting late. I'm getting tired and hungry and
Yeah,
silly.
yeah.
constant. It is constant. I
It's
love it.
nonsense. I
I
love
love it.
it.
Never a dull moment.
I bet not. I bet not. So, any final words? As always, just imparting to people to respect where you are in the moment in time, but to please broaden your perspective of self, because sometimes with these chronic conditions and issues, we really limit our own beliefs in ourselves. And part of it is because of messages we are receiving from the outside. They're very real, they're very patriarchal. You must absolutely decipher the difference between somebody else's voice and your true inner voice. And then you can approach your own workout, whatever that consists of, your cardio, your strength, your stretching, whatever it consists of. You can literally create for yourself if you observe what other people are doing first before you jump all head on because you're enthusiastic and eager. That's great. Let that help you with your motivation, but don't let that obscure the greater good for you. And just understand that you will be able to do movements. Look, I mean, working with paraplegics, if they can do something, we can do something.
Hmm.
Yeah.
Just be careful of I can't, I can't, I can't.
Hey,
Just be
Christina.
careful. So that's really what I wanted
Made
to
it.
say to people.
Welcome in, Christina. You have to check out the
Welcome.
replay
You
of
made
this.
it.
You're going to love it because I know you sit
Oh,
down a lot in the car in the chairs. And
yeah.
we did a chair stretching hip mobility workout. It was really cool. So
Thank
thank you
you.
for coming in. I was just saying, too, we're trying to get my friend Angela here in my channel. What are we trying to get you to? 200, right? At
Yes,
least
that would be great.
200 if you can
Thank you.
subscribe to her YouTube. She is an excellent excellent instructor and helps everyone do the best working out that they can do for their body. Dawn, we were talking about, go check her channel out, J&J Video Reacts. Her talented. She can do things, videos for you that you wouldn't believe.
Right.
And everyone in the chat, I'm just so thankful for you coming.
I want to thank Dawn
Thank
because
you, everybody.
that graphic you created, Dawn, for today's specific class was so cool. Thank you so much.
You're
Thank you,
welcome.
Christina.
Really appreciated that. Really appreciated it.
You're
Thank
welcome.
you,
And it's
Angela.
like, Jen was describing it to me. I'm like, you know what? Let's go ahead and redo that. Let's get a chair in there and let's, because I always like to try to put something in it that has to do with
Right.
and then Jen is in the middle of kind of transforming her brand into amazing transformations. And I'm like, you know what? Instead of just being the Meatless Monday, let's incorporate all of that.
Yeah, that's
So
great.
I'm
Look,
glad you liked it.
I really, really appreciate it because I knew you guys went to work on that immediately for me. And I was like, wow, that's really cool. I appreciate that.
You're welcome.
And
Thank
Christina
you.
has subscribed.
All right.
And Dawn just
Oh,
subscribed. I
yay
would
for
love to do
everybody.
some yoga. Christina
Thank
was
you to the
driving. Be
ABC
careful,
community.
Christina. Yes,
You guys are
EDT.
you guys support so much. Thank you
Linda
so
is
much. I
always
appreciate
here.
you.
You guys are
Love you
amazing
guys.
support system for
These are
Dawn,
the
and I
people I
appreciate
trade
you
stocks
jumping
with.
in with me.
It's my stock trading group.
Oh, that's wonderful. I've
Yeah.
even been to their site. I went to
Go to
their
American Dream Trading.
I went to that. I believe I went to that because you had put
Yeah.
that up, and I'm like, all right, let me go check out what she's doing. I mean, it's just it's fantastic, isn't it? I mean, you can just look at everybody what they're doing online. It's
Yeah.
fantastic.
I
Yeah.
love it. I love that we can all support each other. That's so
Yeah.
important, and I see what you guys do for each other in your, trading group, and we're that way in the vegan group. We try to each support each
I
other's,
love it. I watch it.
videos and live streams, and
We're going
I
on each
love
other's
the
shows. I love it. It's amazing
yes.
to watch.
It was cool, and, I don't think it was so cool to have you on because you give us something different than just the nutrition part of
Mm,
how we can improve our life, and, you're so motivating, no matter how how what situation you're in, there's something you can do. And that I love that you focus yourself on giving those people the hope, and
thank you.
working with people with chronic conditions.
Thank
And
you.
Linda said it's a great community of people we have to learn to trade and we learn to trade stocks. Yes, you guys are. I mean, you're reaching out and even supporting us over here, as an extension. Look, you supported me. Now Angela is getting your great viewership.
Very sweet. Very, very sweet.
Thank you
Guys
for
are
bringing
amazing.
your knowledge to us, Angela.
Absolutely amazing.
Thank you for having me here. I really appreciate it.
We don't want to go. It's all one of those, when we're kids, you hang up first. Anything else? These are the final words, right?
I think I said it all. I
You gave
hopefully
us a lot.
reach some people, to touch some lives, just for a little encouragement and hope. Um, just I'm not a big fan of all the negative messaging. I'm not. And also I'm not a big fan of ageism. I have been absolutely affected by it. And there's that concept of let's just kick you to the curb because you can't procreate any longer. Got it? And that's just
Yeah.
crap. That's just crap. There's so much more to offer each other later in later years, and also what I really dig is the multi generational. Like being on this show means a lot to me because it's multi generational and multicultural. And I think that is extremely important in today's day and age when we are really all like living in glass houses type crap. And it's like,
Yeah.
you know, uh, why do we have to throw pellets at each other? I just don't understand it. But it's very, very predominant in today's day and age. And that's why finding this kind of spirit is extremely important for one's mental health, for damn sure.
Hmm.
And then when you work out, you just kind of build a little bit more self confidence, right?
Yeah.
Yeah.
And I think that's also very important. And that's why it's like, stop telling me no. You stop telling me no.
Mhm.
I'm going to determine my no, you know? And that's what I have to say it. Mostly females need to come to terms with
Mhm.
is you need to listen to your voice and take charge from there. Whatever way you need to do it, you do it. But stop obeying.
Words of wisdom from
Yes,
Angela, Boomer and Beyond
Just
Wellness.
saying, just saying. I'm very passionate about this subject, and I can go on.
I
I can go
love
on for days, but I
it.
don't want to. Yeah, I don't want to do that. But the point is being is we can do it. We can do it. It's just it has to be individualized. We are not a demographic. We are a demographic, but we are individuals within a demographic, and we have to be given an opportunity to express ourselves without
absolutely.
without threat. So
I love
I
it.
like to do it through the body.
Yes, and you do a great,
What a
great work.
wonderful way to do it. You know
Yeah.
what I mean?
Thank you for
Thank
being
you.
here. Thank you, Dawn, for joining us.
Hey,
And
Dawn, did you see JJ on Be Green with Amy?
Yes. Yes,
Wasn't that
yes, yes,
great?
yes, yes.
thank you
Wasn't
for
that great?
referring me over there. That was so cool. I've never been on like
She's
such a cool
fantastic.
show. It
She's
was great.
fabulous to work with, right?
She
She's
is very professional. Everything was so you know, like I need to get my channel to that. Like everything went really easy. I'm kind of running around doing this and that and sending the
I
link
wrote
here.
her and I'm like, you got to have her on. She's doing so much. Her
Oh, thank
wife,
you.
they're doing so much for the movement. You got to have her on. And she was like, send me the info. I'm like,
That is so awesome, Angela. Thank you.
That's what I'm talking about Angela. She
Yeah.
is, she was thinking outside of herself in her own growth and helped me grow. So I appreciate that. And I'm glad
well,
we can
thank
do
you.
this and get you,
Uh,
hopefully some subscribers. And
it's very sweet
I
of
know
you
you
both.
did it from the heart, but thank you.
You're very welcome. And the thing is that for me to be a guest on a podcast show is really an honor. And you're giving me an opportunity to talk about me and my work, right? And what do I do in kind? So for me, when I'm affected and touched by podcast show hosts, I am on a mission. I have gotten a lot of people on different shows
Hmm.
because that's how I do my payback. It's like,
That's
okay,
really cool.
now we got
Thank
to
That
you.
tell
is
other
amazing.
because maybe Amy, because maybe her particular circles and what her demographic is, her larger audience. I said to her, I think you should bring vegan knowledge JJ on because this is different circles for you and different age groups and different cultures. And she just didn't hesitate. She's like, let's do it
I
because
love
we
that.
have to spread this word of ahimsa to not harm animals for our food, period, and therefore not harm ourselves and our planet. And if we see other people as committed, how do we not recommend each other? How do we not? I can't even sit on it. I have to talk to others and share and say, well, that's a great host. Oh, I think they would be great together, kind of
And
thing,
like you said, you never know whose message will resonate with someone. Like I might not, but you might be someone who, they connect with and they say, okay, I'm going to give this a try. And so the more, like you said, different, kinds of people you have on, different ways of eating, different ways of doing things even
Yes,
and working
yes.
out is so important. Like that might be how they transition to getting to you for workouts and hear something about nutrition that brings them to that. I love
Right.
that, Dom. Yes, that's a good one. I like the leaves coming around in the behind.
Plant-based background.
Yeah, it's fun. It's
Thank
fun.
you so much,
Well,
Angela.
thank you both so much. I think you're
Thank you
both
for
fabulous.
everything.
I
We
think you're
love
both
you. Thank
fabulous.
you so much.
I love you guys too. I think you're both fabulous. The messages that you're putting out there, I will always suggest your show, the whole bit. People need to see this. I think it is super important that people see this particular channel.
Mhm.
You're
Thank
amazing.
you.
Thank
I really appreciate
you.
everyone joining
Thank
and
you for that.
subscribing to my
You're welcome.
channel and Dawn and Angela's channel. Thank you for coming on.
Jen,
And
you want to
Mariquita, if she's still out there, Mariquita.
Mariquita, she had a client a few just very shortly ago and had to leave, but she said it was a great show. I'm
I
Awesome.
love
so
the way
happy
you guys
she
say it with the accent. Mariquita.
Mariquita. I gotta get it. I gotta get it right. Mariquita Solis.
That's
I'm
it.
always
There
like
you go.
Mariquita Solis. Just kidding. Narakita is a great person.
Mariquita.
Same way with her, like she's so supportive. She
Ooh,
shares our things and has us on her show, and she was on here, and like I love the community. Like how you guys have the stock community. It's so I love the support that we're giving each other, because some people can become what is it, like they hate each other within.
oh
This
yeah.
is two
Oh
different
yeah.
kind of groups that the world needs to learn from,
You eat
really.
this way and I eat that way. And it's like, listen, let me tell you
We're all
something.
human.
None of us is eating an animal. So cut the crap, however you do it, whatever works. We're not eating an animal. All right.
Right, whether
I
I
just,
eat an orange for my breakfast
I
or a
don't,
smoothie or a
I
juice, if
don't
I'm a
care,
juicer
man.
or a breatharian,
We were
Yeah.
just
I mean,
talking about that. I told Jen
fruitarian.
that yesterday. I said, it's so funny that it seems like there's within the vegan community, it seems like there's beginning to be these groups who separate, who's like, well, it's bad to really eat spinach. Well, no, I think people should eat spinach because of this, that, and whatever. But at
yeah,
the end of the day, there's the common denominator of no animal
that's
products,
it. That's it. Okay.
so
I
yeah,
respect you for that. How you eat, well, it's your call.
yeah.
And I'm sorry
All
because
the little nuances, that's
yeah,
one
and if
another
you're and
thing,
if
but
but if you're
no
trying
animals.
if you're trying to eat,
I've done everything on the diet, so I can identify with everybody. I've done raw, I've done
me
processed
too,
food, I've done
me
junk
too,
food, I've done whole food plant-based, I did
me too,
I don't know,
all of
all of
it.
them. And I returned to the fruit-based raws where I think I
I can't
live,
wait to
but
have
I
some
love all the diets. Like I'll eat all of the food. Bring it all
You're
to
gonna have
me.
what? What are you gonna have? I'm so
watermelon.
Mm.
oh, you see, I gotta go out right now. I'm actually gonna be going shopping now at Whole
Oh my
Foods.
goodness.
Yeah, I
Girl,
need to
you're
grocery
late.
shop. So,
It's a good
but
time to go. You won't be crowded though,
yeah, and
probably.
that's why I do it. That's really why I do it. I'm just like I can't take the crowd.
Christina.
I'm not a fan of I am not a fan of people in a grocery store putting the fruit right up the nostrils. I got
Right.
a
I
thing
don't wanna
about
see it.
there's something about that that makes me go, come on now. Do we have to and then put it down?
Knocking on it and listening to it? No, I'm just kidding. Christina said she eats cookies and watermelon. Okay, you need to coin that diet. I think people would buy that. Cookies and watermelon diet. I love it.
I like her. She's nice.
Cookies and watermelon.
Oh,
Clear
she
your
can
Hillbilly
cache
sing.
and cookies.
music.
Sing.
remember
She can
remember guitars
sing.
and Cadillac?
Say it again.
Remember Guitars and Cadillacs by Dwight Yoakam way back in the day?
Sing it.
Guitars and Cadillacs, hillbilly music, the only thing that keeps me hanging on.
Oh, she's got a beautiful voice.
I told you. We
Nice
made you
stuff.
sing.
Get
She
out
knew
of
what song
here.
it was.
It's like, get out of here.
I
Get
said
out
I
of
typed her
here.
offline, pretend you don't know it. And like
You didn't hear it. You didn't
we used
hear
to
it.
have a little channel called Judd and James where I'd play the guitar and she would sing. That was our
I've seen
first
this
try
too,
at
by the
YouTube.
way. I've
Um,
seen this. You have some of that stuff on YouTube, right?
I think it was on Facebook, maybe. I think we might have some on YouTube. Yeah, I
You
think it might
do.
be
I
on
know you
YouTube.
do. Yeah, yeah, because I know there's another channel. You're like I was. I used to have these channels
All
for.
kinds of
Yeah, I
channels.
got one called Dawn OC somewhere, and I never really put anything
I
on. I did a
lost one that I had like JJ Veganology or something, and I don't even know how to get
Dude,
into it.
remember React Tunes? I had one where I was a cartoon. I made myself into a cartoon, and I was reviewing like little YouTube videos.
We are all trying to find our way. I think we finally found our niche, ladies.
I know. Oh dear God. I know. I know.
We all knew we were destined to be on YouTube somehow, right?
Yeah.
I love it.
Hopefully, Yeah, with something that, that we consider for
Look,
ourselves.
that's how beautiful American Dream Trading is. Coach like got on the horn one day and I was at 600 subscribers for like ever. And he stayed on there until I had hit 1,000 subscribers within like an hour. He had all his people go over and subscribe. And now I'm at like almost 1,400. I'm at like
Yeah, I
That's
saw
1,300.
that. I was
amazing.
like, I was impressed. I was impressed by by your subscribers. That was really cool.
Thank you. That's ADT coming over and supporting. You
Awesome.
know, we're that's an amazing group of
Look, we're
people.
gonna get in on that, Angela, even if we have to go trade stock.
Well,
Uh,
look, hey, look what you're
get
gonna
a
get out of it.
VIP stock membership and get all your YouTube. You
Look,
could have
she
a
knows
reel
we
in.
got the VIP. Look, she hears it all day, every day. She knows what we do.
Mhm. Sponsored by ADT, right? Thank you guys. I'm gonna let her get
Thank
shopping,
you
and I
all.
am
Yeah.
starving. I need an avocado. I'm having a
I need a watermelon.
Awesome. Yeah,
All
I'm gonna,
right,
and
have a
you.
good
I'm
one,
gonna
man.
try to get some cantaloupe from Whole Foods because they've been awesome lately.
Oh, I love my favorite. Ah, they didn't have any this time
Cantaloupe.
for me. I love them.
All right, my dears. Well, thank you so much.
Thank
All right.
you.
Love you guys.
You're
Thank you,
wonderful.
ADT,
You
for your
well.
support. Thank you, Dawn. And go
ADT,
Pet
thank
Boomer
you.
and Beyond Wellness. Love you guys. If we can become a plant-based nation, we could get off all our medication. We want to keep doing things like we were, donating to organizations claiming to fight for a cure. But the cure is already in front of our eyes, and it's time for us to wake up and realize. We may not want to believe we have control. It's easier for most of us to metaphorically live in a hole. So many stories of how being plant-based has reversed disease. It's funny that we can't stop eating meat with ease. We want to continue to look for the answer, yet people have reversed even cancer. I think finally as a nation, it's time to give people the truthful information. Your hard-earned money is what you pay to take your medicine day after day. Sadly, there's a lot of money being made in people staying sick. This has to finally make something click. We have to have this revelation that a cure means not selling medication. There's so many myths and misconceptions, but it's eye-opening once you make the connections. That meat and dairy are causing insulin resistance, it's not sugar and carbs causing diabetes, for instance. Scientifically, our bodies are not set up like carnivores. We model those who eat plants. If you can heal, why not give it a chance? You follow your car's owner's manual for what gas it takes, yet for our bodies without care, we feed it steaks. That's like giving an unleaded car diesel to drink. Our bodies will reject it, don't you think? I'm not here to tell you what to do, but to be a voice, that when it comes to your health, you have the choice. With just a few adjustments to your diet, I can help if you just want to try it. I've found testimonials that people have reversed every ailment and disease by simply eliminating meat, eggs, milk, and cheese. There's a tasty substitute for all the things you already eat. You can get all your nutrients without eating meat. Save the animals, the environment, and yourself just by making a few different selections off the grocery store shelf. It's never too late. I've seen it work at all age ranges. It's my passion, and I can't wait to hear about your positive health changes. It's time for the world to wake up and heal, and you can start with your very next meal.